Gauteng Health is turning to smart technology in order to beef up security for emergency personnel and ambulances. It includes push-to-talk devices, live tracking and cameras in emergency vehicles. It's also hoped this will improve response times. There have been attacks on medics in the province recently. For more on this effort, I'm now joined by EMS Operations Manager Colin Errakiah. Colin, good afternoon, and thank you for joining us on Today this afternoon. Of course, the security of personnel who respond to emergencies in the province has been under the spotlight. Now the Gauteng Health Department is working to beef up the security area. So what are some of the biggest problems currently?
Thank you, and welcome to you and the listeners. I think some of our biggest problems in Gauteng EMS, as you know, we tend to have a huge population in Gauteng at the moment. So what we're trying to do in terms of beef up security, we're working with the law enforcement agencies, and we have actually joined forces with the police force. So we have a member that's full-time deployed in the Joint Operations Center, so that when there is signs of calls that warrant the necessary security, then we engage the police to escort us onto those calls or with those calls. So I think in joining forces, what we're saying is we want a real-time response, not to phone for a SAPS vehicle, but we want a real-time. So as the ambulance leaves, we want the patrol car or the police van to leave at the same time. The second thing, what we're doing is we actually engaging with our communities. There was a study done in 2018 with all the provinces, and the first point of deterrent is community support. So if community can come out in numbers, especially in these hot zones, we've identified hot zones or no-go areas. So that's where we definitely need the escort, whether it be the community policing forum, the ward councillors, the community leaders. We need them to come out in numbers and protect that ambulance, because that's a vital resource. As you know, there's limited number of those resources available. So when you do need it, you want it to be there promptly and save that person within the golden hour. Yeah. The other thing is the Gauteng Department of Health is also coming up with a strategy in terms of re-looking at the security deployment at the EMS stations. So even when the crew gets a call, if we have armed response from our stations in terms of the current security that's at the EMS stations, they can actually respond with the crews. So I think further to that, to the smart technologies, we're also looking at some kind of voice recognition system that it can actually tell you when the call comes into the emergency communication center, whether it's a real emergency or whether it's a hoax call or a false call, as we've noticed now in the trends of the paramedic attacks that's taking place. So I think other than that is we've investing in smart technology in terms of our push-to-talk radios that can actually do live tracking. So whenever a crew goes to a call in a hot zone or a volatile area, our control room, we have special people that actually track those people where they're going to. Every crew member gets a radio so that you could see, even if one is waiting and one is treating the patient, so you can track both members at the same time. And they also come with panic buttons. And also our ambulances also have panic buttons as well. I think, yeah, I've covered enough. Yeah, thanks.
No, I've just been listening there intently, giving you time to explain all these different measures that you, together with the Department of Health in Gauteng, are putting into place to make sure that the personnel who go out are safe. But one of the aspects that you've touched on is around emergency response times. Will the new smart technologies help you to improve on that? Because you have been criticized even by the likes of the opposition party, the DA.
Yeah, thanks. I think some of the greater public to understand is majority of our patients are in the informal areas, and also only 3% of our calls are the primary one calls, which we call them P1 calls. Those are life-threatening calls where somebody could actually die in that situation if they don't get emergency help within that golden hour. So that's 3%, which is made up of 1% of medical cases and 2% of trauma cases. But all the other cases that we do respond, that's your less life-threatening and your minor calls, we're doing it within up to 88%, between 88 and 96%. We are responding within time. So within an hour, people do get emergency medical help.
88%. Can the smart technology help you to improve on the 88%?
Yes, definitely. The smart technology also comes with Google Maps, so they live integration into that area. You know, at the moment, some of the informal settlements, they don't have house numbers. But also what we're saying is we're linking with the security forces in terms of when they do join us, that they join us quicker in terms of getting to that scene. So it definitely is going to improve the response time to those emergencies.
Okay. We've seen some recent protests in Gauteng, and sometimes your guys get affected. How have you been affected, if at all, by some of these recent community protests?
Yeah, I think to just unpack it, these protests are sometimes planned and sometimes are unplanned. So the planned ones, we can actually respond with the security agencies and look at alternate routes, or we can advise the caller to say, this is where you should take the patient, avoid this route. But if it's unplanned, when our guys get there, somehow the community that's doing the service delivery protest, they take out some anger on the ambulance, and it really delays that call. It also delays emergency treatment to that affected person or child or sick mother or father out there. So it really, really hampers us. And in that situation, all we can do is advise the caller to say, we offer some kind of medical guidance to you, and then we wait for the public order policing to give us a clear route to go in. We've had instances where ambulances were stoned from these service delivery protests, tires being stabbed, ambulance being grounded at those service delivery protests. So I think it's also a cost implication to the department every time an ambulance gets damaged in those scenes. So we're trying to avoid it. At the same time, we're trying to keep more ambulances available to service our operations in Gauteng, given the number of calls that we're servicing at the moment.
Yeah, Colin, final, can you just remind us, how should we react to emergency crews and ambulances when there is an emergency? I mean, if you're driving down the road as a motorist and the siren is going, you see that's coming, we tend to move to the side to allow your guys to move through. But generally, how should we be reacting?
Yeah, I think that's exactly what you said. I mean, most of the times you look at Gauteng, especially in the urban areas, at your peak hours, the roads are highly congested. Most of the public are taking your warning lanes, your emergency lanes. So that ambulance responding in traffic has no way of responding within that 30 minutes. So we're making a plea out there to public to say, give us the right of way when it's an emergency. When you hear the siren, when you hear the red lights, when you see the red lights on in your rearview mirror, you know it's an emergency. It could be your family member, it could be somebody else's family member. But we never would put it on just for nothing. We're putting it on because there's a definite call and we want to save a patient out there. So that's exactly why we do it.
Okay.
We want to, actually respond to calls immediately.
Okay, thank you very much.
I think also...
Yeah, quickly?
I must emphasize one more thing, yeah. I think also, the recent spate of hijackings that have taken place also affect our crews out there. And I mean, they are our human resources. We've had 2 in the last month, and that's severely affecting our operations because it has a psychosocial impact on our staff, when they go to hijack. And if you've seen what happened, the modus operandi now is they're actually taking our crews and robbing them of their valuables, even their personal valuables. But we're looking at security measures. Okay. In terms of what we're doing, yes. But I think that's definitely having an impact on us.
Okay, the hijackings, yeah. Thanks, Colin Errakiah. He's operations manager at the Emergency Services EMS, just giving us an update on how they're trying to improve security in order to protect their personnel.